Good day, I am Aldrin Havaliano and this is a CHN scale cold application. So ice can be used to apply cold therapy in the form of an ice bag or in a glove. Commercially prepared cold packs are also available. Now this procedure has four purposes. Number one, cold constricts the peripheral blood vessels, reducing the blood flow to the tissues and thus decreasing the local release of pain-reducing substances. Number two, cold reduces the formation of edema and inflammation, reduces muscle spasms, and promotes comfort by slowing the transmission of pain stimuli. Number three, the application of cold therapy reduces bleeding and hematoma formation. And number four, the application of cold using ice is appropriate after direct trauma, for dental edema, for muscle spasms, after muscle spasms, and for the treatment of chronic pain. For this procedure, you may need hand washing materials, an ice bag, ice collar, or disposable glove, a bath towel, ice, a small towel or washcloth, um, a bath blanket, and a waterproof pad. Start the procedure by checking the physician's order or the nursing care plan for the application of cold therapy, including the frequency, the type of therapy, the body area to be treated, and the length of time for the application. This will further ensure that the medication to be given by the nurse is correct and identical to the physician's order. Then identify the patient to ensure that the treatment is given to the right patient. And then after that, explain the procedure to the patient to facilitate cooperation and decrease their anxiety. Then after that, assess the condition of the skin where the cold is to be applied. This is to check the skin's integrity and ensure that applying the cold compress is acceptable for the skin's current condition. Now, after that, assess the sensitivity to temperature and pain using a light touch, pinprick, and temperature sensation tests. This is to assess how the patient can tolerate the cold temperature. Then after that, gather the equipment needed to save time and for efficiency. Once you have gathered the equipment that you need, perform hand hygiene to prevent the spread of microorganisms, assuming I'm already done washing my hands. The next is to close the room door or curtains and raise the bed to a comfortable working height to provide privacy and increase patient comfort. Then assist the patient to a comfortable position that provides easy access to the area to be treated, and expose the area and drape the patient with a bath blanket if needed. Then after that, put a waterproof pad under the wound area to protect the bed if necessary. Now this ensures patient comfort. Once you've already settled your patient, next thing you're gonna do is fill the bag or ice collar or glove about 3/4 full with ice. And remove any excess air from the device before securely fastening it. This is to avoid unnecessary weight on the body part, especially if applied to the abdomen. Now, it allows the bag to mold over the body area to be applied with, and securely fastening the end of the bag or the collar will secure or ensure rather that it is not leaking. Now, cover the device with a towel or a washcloth if the device has a cloth exterior. So the cover retains cold for more gradual application and absorbs the water formed by atmospheric condensation. Then, if necessary, put on some gloves and remove and dispose of any dressing at the site if there are any. This is to avoid or prevent the transmission of microorganisms. Since the patient doesn't have any dressing to be removed, proceed to placing the device lightly against the area, then remove the ice and assess the site for redness after 30 seconds. Then ask the patient about the burning sensations. This is to prevent the effects of prolonged exposure to cold and secondary effects, which is vasodilation, which can lead to low blood pressure. Now, after that, place the device snugly on the site and secure it in place with gauze wrap or tape. This is to ensure maximum therapeutic effects and to prevent it from moving. Then, after this, reassess the treatment area every 5 minutes or according to institution policy. This is to monitor any signs of the effects of prolonged exposure to cold and the secondary effects. Now, after 20 minutes of the prescribed amount of time, remove the ice and dry the skin. This is to promote treatment effectiveness and prevent manifestation of signs of prolonged exposure to cold and promote comfort to the patient. Then, if necessary, apply new dressing to the site. This is to protect the wound. And after that, assist the patient to preferred comfortable position for the promotion of patient comfort. And after that, do an aftercare of the equipment and dispose soiled items or linens rather to prevent the spread of microorganisms when using the equipment again. And disposing of soiled linens also avoids possible transmission of microorganisms. And after all of that, perform hand hygiene to prevent the spread of microorganisms. And lastly, document the procedure, the patient's response, and your assessment of the area before and after the procedure to ensure that valid conclusions are made, since it provides a correct amount of the treatment and the care given to the patient when the data are analyzed. Also, it ensures the continuity of care as it serves as a communication tool among healthcare providers.